So we're doing something called the Discover Series. And the Discover Series is get to know your healthcare system. And we're starting today with the Weill Cornell Medicine. Next month, we're with Hartford Healthcare. The month after that, we're with Mount Sinai. And then after that, we're with Columbia. There are more healthcare systems, but we decided to start with 4 this year. Anyway, so I'm very grateful for Dr. Sarva and Dr. Weill here with us today. And I want to introduce them to you, and then they're going to take over. And then after they speak, we have Dara Coleman, who will feed right into Dr. Wee's talk when he talks about the breath. So Dr. Sarva, I'm getting to know, and Dr. Weill. Dr. Sarva completed a combined undergraduate medical school 8-year program at CUNY Brooklyn College and SUNY Downstate Medical Center. She completed her undergraduate degree in economics with a magna cum laude from Brooklyn College. By the way, we're very fortunate to have these doctors here today. They're brilliant, and takes a lot of time out of their busy schedule. They do a lot of research also, and we're just very grateful that they're here. And after completing her MD, Dr. Sarva was recruited to complete her neurology residency from SUNY Downstate, where she was also a chief resident during her final year of training. She won the SUNY Downstate Alumni Association Outstanding Resident in the Department of Neurology. Dr. Sarva completed her fellowship in movement disorders under the mentorship of Dr. Susan Bressman and Dr. Rachel Saunders Pullman at Mount Sinai Beth Israel. During her second year of fellowship, she was awarded the Clinical Teaching Fellowship Grant from the Dystonia Medical Research Foundation. And after completing all of her training, she was attending in neurology at Maimonides Medical Center in Brooklyn, where she was co-director of medical student and resident rotations and developed a movement disorders elective for psychiatry residents. Dr. Sarva specializes in Parkinson's disease and the movement disorders, and she is board certified by the American Board of Psychiatry and Neurology and is author of numerous publications. So welcome, Dr. Sarva. I'm going to tell you about Dr. Weill also. Dr. Sarva said, you have to meet Dr. Evelyn Weill. So Dr. Weill is an assistant professor of clinical neurology and assistant attending neurologist at New York Presbyterian and Weill Cornell Medicine, specializing in Parkinson's and other movement disorders. Dr. Weill earned her BA from Wellesley College with a concentration in biochemistry and art history, and her MD from SUNY Downstate Medical Center. She was recruited to stay for neurology residency at SUNY Downstate and completed a 2-year movement disorder fellowship at Mount Sinai Beth Israel under the mentorship of Dr. Susan Bressman and Dr. Rachel Saunders Pullman, which I gather is where you met. Actually, Dr. Jose Cabasa told me that he wanted to come and be with you. He was one of your teachers, right? Yeah, right. So after completing her training, she was recruited back to SUNY Downstate, Maimonides Medical Center, where she served as assistant professor of neurology and attending neurologist before joining New York Presbyterian and Weill Cornell. We are grateful to have these 2 wonderful doctors here with us today. And I think Dr. Sarva, you are starting off, right? Okay.
No worries. That's yours. Okay. Oh. Yeah. Oh, one at a time. you want us to? I, no, we have sound. We just need my slides up. Yep, that's it. Better? Okay. So thank you, Susan, for the amazing introduction. And thank you everyone for attending today. So I will review our institute briefly and go through some of the research studies that we've been a part of. Oh, that way. Okay. Okay, that's perfect. Thank you. So a little bit of history about Weill Cornell. It was founded in 1898 and has been affiliated with New York Presbyterian since 1927. The medical school is one of the top ranked in the country. Our department has 14 clinical divisions, among which we are one of them. And our Parkinson's Disease and Movement Disorder Institute is located at 428 East 72nd Street. We also have satellite movement disorder sites at 156 William Street, where Dr. Rivka Sachdev, who's an amazing physician, is practicing. And we've also been partnering with the Brooklyn Methodist group as well. So that's all of us in a nutshell. So Dr. Roween, who's been an amazing addition and partner, Dr. Andrea Yu, who also trained with Dr. Bresman and Dr. Saunders Pullman, and we're very lucky to have her. We have two wonderful nurse practitioners, Natalie Helmers and Melissa Lopez, and Dr. Sachdev, who's downtown. So a little bit about what we do. So we're probably the smallest groups, or among the smallest groups in the city, but I'd like to quote my chair and say we pack probably the biggest punch. We really do have a multidisciplinary team of specialists because it's us, our nurse practitioners. We're very close to our memory disorders doctors. We work very closely with neurogenetics, and we have an amazing functional surgery department led by Dr. Michael Caplet. So we are involved in a lot of the state-of-the-art therapies. Many of the medications that are being shown here, we prescribe. We're actively involved in deep brain stimulation, MRI-guided focused ultrasound, as well as expertise in botulinum toxin therapy. And we're one of the leaders in terms of clinical trials for Parkinson's patients. So I want to highlight a couple of studies that we've completed in the last 3 years. Okay. So in the past, when we've talked about sort of neuroprotective trials, right, there's been a lot of repurposing of either blood pressure medications or vitamins to try to slow Parkinson's down. And they've all targeted really just the dopamine neurons. So if we can save the dopamine neurons, then the Parkinson's won't progress. But there's more to Parkinson's disease than just the dopamine neurons. There's a lot of different pathways that are involved. So that's why a lot of those really didn't work out very well. But this is one of the novel drugs that I feel has shown a lot of clinical potential. There's good science behind it. And it's a new leukemia drug that has been tested in slowing down disease progression. And you might be wondering why a leukemia drug? Because the pathway that it targets is also involved in Parkinson's disease pathology. So there's an enzyme that's, and you're going to hear a lot of this, where it's overactive. And if you can tune it down a little bit, then the rest of the, one of my colleagues used to call it a garbage disposal system of the brain, works better and can clear out, excess chemicals, excess proteins, and keep the nerve cells alive. So this was a phase 2 study. So it showed safety in numerous phase 1 trials. The animal data were good. The early people data were safe. And so it was launched in a multi-center, multinational study that recruited over 500 patients. And it completed recruitment last fall. And the idea was to test this novel chemotherapeutic agent in patients who were diagnosed within 3 years and not requiring medications. So it was a 44-week trial. And then after that, they provided a 40-week open label extension period where people can actually receive either low dose or high dose treatment. The data hasn't been analyzed just yet. So we're still waiting. We actually snuck in the last patient to be randomized. So once he's completed, hopefully we'll have a data cut and it'll give some positive results. It's not a cure, but it's a step at really targeting different pathways to slow it down. If we're able to effectively do that, then the next big step would be to reverse the condition, but we have to learn to slow it down first. Side effects have not been so bad as far as what we've experienced as well. I think we just had a little bit of stomach upset and maybe some swelling in our trial patients. Because this drug was also being tested in patients with severe leukemia, they obviously are much sicker patients because they have a lot of cardiac problems. They had a lot more side effects than the Parkinson's cohort. So safety-wise, I think we're in good shape. And so hopefully the efficacy pans out as well. And if there's signs of efficacy, it'll go on to a phase 3 study, which we're very hopeful of. So the next study that I want to highlight that we were a part of is the Neuroderm trial. So rather than taking levodopa pills and or getting, brain surgery, I'm sorry to all the DBS sponsors in the room, but for patients who are having ups and downs in their day-to-day dosing, this offers a subcutaneous delivery pump, like an insulin pump. AbbVie also came up with their own subcutaneous delivery system. We were not part of that study, but that study also showed good results in terms of 24-hour levodopa duration. This as well, at least more than 2 hours in on time without bothersome dyskinesia, which is really important. And we're just waiting for FDA approval on this. But it's been an exciting opportunity for a lot of our patients. The one annoying thing I will say about the pumps are all of the skin nodules that people develop. It's very common. About 30% of patients, whether it's the AbbVie pump or the Neuroderm pump, are developed these skin nodules. They go away with time. Very few had really bad skin reactions. So we think it's a good, safe delivery mechanism for carbidopa-levodopa. Of course, this is probably one of our premier studies and the one that gets everyone the most excited about because it's our stem cell trial. So we partnered with Memorial Sloan Kettering and Blue Rock Therapeutics, and we completed a phase 1 study looking at dopamine precursor cells that were transplanted directly into the brain in 12 patients. So they were aged anywhere from early 60s to about mid to late 70s. Disease duration anywhere from about 5 years to about 12 to 13 years. The initial cohort, so the results were positive in that it was shown to be safe. The transplant survived, which is really important, right? You don't want to go through 6 hours of brain surgery and the transplant not survive. The side effects people had were not transplant related. They were mostly related to the immunosuppression drugs that people have to be on for a year to save the transplant. I know that sounds like a lot of extra medications, but they were monitored very closely by one of our transplant specialists. Most of the time it was done seamlessly. People actually traveled from out of state, so it can be done. And at the 2-year mark, we're showing that the transplant is still holding, and there's some preliminary signs radiographically. So when they did PET scans, that the transplant was in good shape, and there were some clinical signs to suggest efficacy. Again, very, very promising, very small number. So they got the go-ahead to move on to a bigger phase 2 study. Prior to that, they're doing an observational study right now. That's going to end recruitment probably in the next 2 months. And then hopefully by the end of this year, the phase 2 study, surgical study, will start. But because it's a phase 2, there's randomized to treatment versus sham surgery. And after the randomization, anyone who got the sham surgery can go ahead and get the stem cell transplant. Another exciting study that we literally just completed recruitment for this past week is the MIRA GTX gene therapy trial. So there are a lot of different gene therapy trials that are being looked at. The difference between the cell therapy trials and the gene therapy trials is that the cell therapy trials are implanting dopamine precursor cells into the brain so that they'll eventually mature and produce your own dopamine. The gene therapy trials are using inactive viral vectors to put in genes that will either create more of a specific enzyme to make a different chemical or to improve functioning of an enzyme that's not working in the brain. So it's actually changing the genetic component of it a little bit. So this was a phase 1 study. This therapy actually was looked at over a decade ago by Mike Caplet at Cornell. And because the processing of the treatment was altered, they had to basically do it over again because of the FDA. So the idea was also to look at this novel therapy in patients who are having ups and downs in their medications, who may be having dyskinesia. And the idea is that if you put in an enzyme that makes a chemical that sort of slows down certain nerve pathways, it allows other pathways to function better. So it's kind of an indirect way of making your movements more coordinated and strategic. The initial data that was actually published 10 years ago showed good efficacy and very good safety. So we're really excited about this. And I think they actually want to move to a phase 3 by the end of this year. So that's actually quite exciting. So that's some of the very interesting stuff that we've done over the last 3 years. And then moving on to some of the things that we're doing right now. So current studies. And we'll start with the 2 or the 3 early PD trials. Okay. So Genentech Roche has come up with a new molecule that in the simplest terms is looking at is an anti-inflammatory molecule. So we know that environmental factors can create inflammatory changes, not just in the body itself, but also in the brain. And so this molecule is looking at tuning down some of those inflammatory markers so that the pathogenesis, the pathology doesn't continue. This is a phase 1 study. So it's within 5 years of diagnosis. It's for both patients who are on carbidopa levodopa and who are drug naive. It's a little bit more involved than some of the other studies because patients need 2 spinal taps. They need to go to New Haven for a specialized PET scan. But it's an exciting concept. And if it shows to be safe and most importantly, and potentially efficacious, they'll move on to a phase 2 study. So again, it's another early PD trial looking at a different mechanism to slow things down. And this is also going to probably stop recruitment very soon, probably in the next month. So this is the study Luma, that I think pretty much every movement disorder center worth its weight in gold is a part of. So this is testing out what's called a novel LRRK2 inhibitor. So LRRK2 is it's ubiquitous. So it's an enzyme that's in the brain, your lungs, and in your blood cells, and it has normal function in all of those organs. Whether you have a mutation in the gene for that enzyme or not, when it's not working properly, we know that it leads to problems in Parkinson's. And over a decade ago, they've been trying to work on good molecules to reduce its effects. The initial molecules didn't work very well because they had a lot of what's called off-target effects. So they were causing problems with white blood cells and red blood cells and lungs. This molecule did not. So the animal data was good. The phase 1 data showed a lot of good safety. And so this is a large phase 2 trial for both patients who have this mutation and those who don't. Within 2 years of diagnosis, preferably not on medications, still actively recruiting. It's a long study though. It's almost a 2-year study. But despite the fact that it is placebo controlled, I always say it's your best chance at neuroprotection. And I think it's a very exciting prospect because this problem is quite ubiquitous in PD. So this is a newer study that we just got approved for, and it's open for the last couple of months. It's not specifically a neuroprotective agent, though. So this molecule was looked at adjunctive therapy for patients who are on carbidopa levodopa and who are having fluctuations. And what they found was that it was effective in reducing those fluctuations. It also found that it helped some patients with their sleepiness too. So they want to see if they can try this molecule in patients who are not on medications within the first 4 to 5 years of diagnosis to not only help their stiffness and slowness, but maybe their sleep as well. So both motor and non-motor symptoms. And because it's not a dopamine targeting drug, it has the potential of giving us another target to help patients symptomatically, if not to slow down their disease. So it's a shorter study. There's no spinal taps. There's no crazy scans. It's a 12-week study. And I think it's good because they also are looking at how it's affecting non-motor symptoms. And we don't have enough effective therapies for sleep disorders, anxiety, depression, and cognitive problems. So this is something that could potentially give us an additional therapeutic agent. Okay. So moving on to what everyone wants to ask us about are the stem cell trials. So again, we have 2 stem cell trials in the works. One was the phase 2 Blue Rock study that's going to most likely start at the end of this year. And Novo Nordisk has their own stem cell trial that's going to start the summer of 2025. There are pre-surgical trials for both companies. For Novo Nordisk, you have to be part of their observational study in order to be a candidate for their surgical study. The reason they're doing that is because they want to make sure they're picking the right people, and we know that the person is perfect for the study because it is a surgical study. For Blue Rock, you don't have to be part of the observational study. You can actually just sign up for the surgical study. Is that the right way to go? I don't know. I think it's always easier when we know the people for some period of time. We have time to check the medical records and build a rapport. But either way, the idea behind both studies is that they're trying to give patients the home diaries, the 3-day diaries, and assess how much off time people have and how good people are at recognizing their symptoms. Okay, so this is the Blue Rock study. I just want to highlight that there are only 8 in-person visits. They're quite spread out, so it's very doable. The next one. And this is Transcend 1 is the Novo Nordisk precursor study. Both exciting. Both surgical studies have slightly different inclusion-exclusion criteria. So if someone misses out on the Blue Rock study that's gotten a lot of press, they might still be a candidate for the other. So gene-specific studies, which is important because we're doing a lot more genetic testing now. So while LUMA looks at LRRK2 inhibitors, and if you have that mutation, you'll be a good candidate for that for an early PD trial. GBA-BL, which is it's a European company, they came up with a molecule for patients who have a GBA mutation. So when patients have this mutation, we see it in about 15 to 20% of the PD cohort. So if you haven't gotten genetic testing, it's something you should speak to your doctors about. There's a certain enzyme in the brain that's not working well. And when it doesn't, there's a buildup of excess proteins. This molecule is, again, modulating that so that those proteins will clear out and that the pathology doesn't build up as much. The safety profile is good. Again, it passed phase 1 safety checks, so it's actively recruiting. Not a lot of really invasive procedures other than some blood draws, not a big time commitment as well, so something to consider. And so if you haven't been genetic tested, please speak with your physicians, or you can also reach out to our center, and we're happy to do genetic testing for patients. A couple of brief symptomatic treatments. So we're always looking at treating dyskinesia better, right? Amantadine has been around forever. And how many of you know the story behind amantadine? It was we found it serendipitously, essentially. So when they were treating patients with influenza and Parkinsons with amantadine, they found that they were able to treat 2 birds with 1 stone. So that's how we were prescribing amantadine for Parkinson's patients. And then, of course, we have the long-acting Osmolex and Gocovri. But this is a different mechanism to treat dyskinesia. So for patients who are hesitant for surgical intervention and they just want oral therapies for treating their involuntary movements, this is a prospective trial for them. And lastly, I do want to highlight this study because the idea behind it is really good. It's coming out of the University of California, San Francisco. Fall prevention is really, really important. And also, as we get older, osteoporosis is very, very common. So they wanted to see if they're able to give one dose of a osteoporosis drug, if it'll reduce morbidity and mortality in our older population with Parkinson's. So if you don't have a diagnosis of osteoporosis, if you've never received osteoporosis treatment, you're over the age of 60, you don't want to come into Manhattan for numerous visits and blood draws, this is probably the perfect study for you because they will come to your house. Everything is virtual. You get one dose of drug or placebo, and they'll follow you periodically. And I think they're also actually giving patients some financial support as well for being a participant in the study. It's an old osteoporosis drug. We know the safety profile of it. It's a good option for a lot of people who want to be involved in clinical research, but either the study commitment is too long or too invasive. It's a valuable study, and the people who've developed it have been leaders in the field for a long time. So now that I've kind of given you a whirlwind of what we've been doing at Cornell, let's talk about why joining a clinical trial is important. We can really only reach breakthroughs in any of these things: diagnosis, development of biomarkers, understanding the pathophysiology, or developing treatment through clinical trial participation. But participation rate is very, very low, and it's even low against different, ethnic groups and ethnic minorities. So if you hear about a clinical trial, whether it's through friends or the internet, what should you really do about this information? First and foremost, talk to your doctor about it. See if it's really worthwhile, because there's a lot of miracle cures that are being proposed on the internet, and they're exactly what they are, miracles, but they're not doing anything really. You want to really look for research studies conducted at reputable institutions that have been conducting studies for a long period of time. When you go for the appointment and you get the consent form, don't sign anything, obviously. Read through it very, very carefully. Go through it with your family, with your doctors. Write down a bunch of questions and tell the clinical trialist, I want to speak with you before I come in for my consenting visit about all my questions. And that's what we do for all of our prospective clinical trial patients. We tell them about the study, we give them the consent form, and we set up a subsequent call so that all of their questions and all of their fears are allayed before the day of the visit. And if you want to know about legitimate clinical trials, clinicaltrials.gov, Fox Trial Finder, Center Watch, Parkinson's Study Group, and PD Generation are the sites you should be going to, because you want to know what's in the pipeline for human delivery. There's a lot of great animal research being done, but a lot of it falls by the wayside, unfortunately. So a big thing is about the legacy of clinical trial participation. And I think, whether you do it for altruistic means or, you want to get the latest and greatest treatments, regardless of your motivation, it is really important, because if we don't have clinical trial participation among a varied cohort of multiple ethnicities, multiple age groups, then we're really not developing the best treatments for any condition, let alone Parkinson's. And we know that Parkinson's is so different, not only between men and women, but also amongst various ethnic groups, and also how it affects younger patients compared to older patients. And so if we don't have enough of a good representative sample, we're just basically giving people the same meds that they've heard of for the last 70 years and not really making a lot of progress. And also it allows us to really understand what we're treating. For the longest time, we were only looking at the dopamine neurons and nothing else. And so it's only been in the last like 4 years that we're looking at different pathways and different mechanisms to try to help our patients. And that's really important. So thank you for your time and attention. That's our coordinator's number. That's our office. Please feel free to reach out. Thank you. It's within 1 to 7 years of diagnosis. So it's a pretty wide range. So there's a good chance that person might be a candidate for it.
Okay. Yeah. Oh, that's okay. Sure. Okay, so thank you, Susan, earlier for that very kind introduction, and I'm honored to be with you all here today. So moving on from clinical trials, I'm going to be talking a little bit more about our day-to-day management of Parkinson's disease, specifically focusing on one of our new developments at Cornell, the LIFT Supportive Care Clinic, which is really focusing on all aspects of Parkinson's disease beyond just movement symptoms. Oh. Is this good? This is better. Okay. All right. So I'm going to be talking about one of the new developments at Cornell, which is our LIFT Supportive Care Clinic, which will really focus on a lot of the non-movement aspects of Parkinson's disease. And then we'll move on to talk about stress and stress management in Parkinson's, which plays a very big role. Okay. Okay. So we can move on. Okay. So as you all know, Parkinson's is a multifaceted syndrome. In the beginning, a lot of focus is put on movement symptoms or motor symptoms like slowness, stiffness, tremor, trouble walking. But beyond movement symptoms, a lot of people deal with a number of what we call non-motor symptoms. And this can range anywhere from sleep issues, lightheadedness, dizziness, GI symptoms, urinary symptoms, blood pressure issues, mood issues, and sensory symptoms. So when you go to your doctor's office, unfortunately, there is a limited amount of time. And what has been the case historically, for better or worse, is a lot of focus on movement symptoms, assessments, and medication management. And a lot of the non-movement symptoms, even though they may be the main issues that a person with Parkinson's is dealing with, oftentimes falls to the wayside. So to that end, we've developed a LIFT Supportive Care Clinic at Cornell, which is not a new concept, but can be very critical in any movement center and really providing the best quality of care for our patients. So our clinic just started last December. It's really been spearheaded by our wonderful nurse practitioners, Melissa Lopez and Natalie Helmers. And the clinic really focuses on a model of overall neurologic wellness, and it utilizes this model on key components of wellness. So this is a diagram by Dr. Subramanian and others. So it really puts forth the idea of neurologic wellness as more than just an absence of disease, but it really takes a holistic approach, conscious, active decisions to maintain a healthy lifestyle. So this can range anywhere from addressing sleep, exercise, diet, mind-body approaches, social connections, and all of those things really need to be addressed in order to get the best outcomes and the best quality of life for any individual. All right, so our LIFT Supportive Care Clinic, again, started in December of last year. So the little bit of the logistics, the way the supportive care clinic is run. So meetings consist of 1-hour visits with our nurse practitioner and social worker. So we're very lucky to have that time. And it is geared towards not only people with Parkinson's disease, but people with any chronic neurologic condition from the Memory and Movement Disorder Center at Weill Cornell. The nurse practitioners and social worker, they have been excellent in really identifying what are the main motor or non-motor issues that a specific person is dealing with, and trying to come up with innovative ways to address those, whether it's connecting that person to additional resources, giving them a safe space to speak, And really the goal is at the end of that visit, each person and their caregiver should feel a little bit more comfortable. They should leave with an individualized care plan and moving forward, acting on that care plan to make some meaningful change in their life. Okay. All right, so again, 1 hour nurse visit, would approach the patient holistically, individually, and come up with an individualized care plan. Another exciting aspect to our LIFT supportive care program is moving beyond the one-to-one visits. And we really are focusing on an overall educational program. So to that end, our nurse practitioners have put together a wonderful agenda with different speakers and topics throughout the year. These are all held virtually and they're free and they're welcome to anybody. And we've had good feedback so far. Another important part of the supportive care clinic is this is a new development and we are open to feedback. So as part of this project, we're focusing on quality improvement, incorporating feedback from patients and caregivers who have gone through this, and really working with the feedback to try to continuously improve and make this the best tool, best resource for our patients that we can. Okay, and key members again are our wonderful nurse practitioners. This would not be here without them, and we are very excited to have a social worker, Abigail Weiss, join us soon. Okay, so if we can go back to the previous slide. So this is the upcoming educational sessions I was speaking about. Some of them have already passed. So we've had some wonderful sessions about future life planning, cognitive well-being, and sleep hygiene. And we have a few others that are coming up, and just the sessions that have already happened. We've had wonderful feedback, and a lot of people took away a lot of valuable information from that. Okay, so moving on from our supportive care clinic, one of the big reasons why we do this is to address one of the non-movement issues, anxiety, depression, and stress in Parkinson's disease patients. So stress exists, everyone has stress. Stress is an emotional response to an external situation in your life. But in Parkinson's particular, there's two additional caveats to take into consideration. So one is that people with Parkinson's disease do experience stress to a greater degree. Multiple studies have shown that people with Parkinson's have higher levels of perceived stress. And the other thing to make note of is that stress, again, everyone deals with stress. Stress causes physical symptoms in anybody. When anybody feels stressed, anxious, heart rate goes up, you break into a little bit of sweat, you get that knot in your stomach. But important for people with Parkinson's is that stress can also exacerbate Parkinsonian symptoms, the movement and non-movement issues. So why is this? So the idea is that people with Parkinson's, you're already dealing with altered neurochemistry. So Parkinson's is a state of dopamine deficiency. In people with Parkinson's, again, you also have mood as non-motor symptoms, so higher levels of anxiety, depression. And when you have a stress response, it really is a physical response. So you have elevated stress hormones, and that leads to overactive sympathetic nervous system. So in the short term, with evolution, that probably gives you a benefit. But the issue is when you have chronic stress linked to long-term toxicities and changes in the brain. So all of this sounds very scary, but the good news is that perceived stress is modifiable, and there are a number of ways we can go about doing that. Okay, so stress management. So there are a number of tools available, and we're very lucky to have. So one is focusing on self-care and lifestyle modifications, making sure, again, you're using that holistic approach and optimizing your overall health. Then we can also utilize meditation, exercise, psychotherapy, and then in cases where it's needed, medication to help really relieve the anxiety and allow you to respond to stress in a more optimal way. Okay. So I'll focus on two particular treatment methods. One is meditation, mindful meditation, and then we'll talk a little bit about exercise. So mindful meditation, there are a limited number of studies, but studies have shown clearly that mindful meditation works. It decreases stress and increases healthy behaviors. So in fact, there was a randomized control trial that was published early last year that showed that in comparison with mindful meditation versus regular exercise. So in this particular trial, they used stretching and resistance training exercise. actually people with mild to moderate Parkinson's who participated in an 8-week mindfulness meditation program. They were better at addressing their depressive symptoms and maintaining emotional stability compared to the same people with mild to moderate Parkinson's who participated in the exercise program. So both definitely have their benefits, but mindfulness meditation definitely has a role in helping manage mood levels, emotional stability. So why is this? So again, a lot of research still needs to be done to fully understand the role of meditation and mindfulness and the changes it can have on our brain. But it's thought that calm, repetitive tasks can send a safety signal to the nervous system, strengthening the relaxation limb of the nervous system, or something called the parasympathetic nervous system. When you participate in meditation, you learn to ignore intruding thoughts in order to stay focused on a repetitive task. It allows you to focus inwards and allows you to explore self-awareness. Okay. So at Cornell, we've been very lucky to participate with Dr. Sarah Mulakula, who's here today. So she has a wonderful program with mindful neurology called Learn to Meditate. It's an online meditation course. It's a program that covers that she developed specifically for people with Parkinson's disease, and it really focuses on learning to activate the body's relaxation response, to identify ruminative thoughts and how to suppress them, and it also focuses on self-compassion and mindfulness basics. She's run several courses. Yes, right there, yes. There you go. Yeah. She's run several courses so far. We've been very lucky to be able to offer her course to our patients at Cornell, and we've had wonderful feedback from both patients and caregivers. All right, so moving on from meditation and mindfulness, exercise is definitely one of the big treatment, I would say mandatory treatment options we have for people with Parkinson's disease. So exercise has clearly been shown to be neuroprotective. It's probably one of the only neuroprotective treatments we have for Parkinson's disease that is available to everyone at this time. So through the Parkinson's Outcomes Project, it's been shown that just 2.5 hours of aerobic exercise per week does slow down the decline in quality of life in people with Parkinson's. It improves motor and non-motor Parkinson's symptoms. So again, I cannot stress this enough. Every time you go to your doctor's office, they should be emphasizing exercise, exercise, exercise. Okay, so why does exercise have such a big role in Parkinson's disease neuroprotection? So if we look at the molecular mechanisms, again, ongoing research, a lot of research is being done into the role of exercise and how it modulates the brain and provides that level of neuroprotection, but it's thought that one of the avenues is through neuroplasticity. So neuroplasticity refers to the ability of the brain to change and compensate for certain losses. So in Parkinson's, it's the loss of the dopamine neurons. So there's been numerous animal models that show that while exercise doesn't necessarily affect the amount of dopamine in the brain, so unfortunately, it doesn't increase dopamine or regenerate dopamine neurons, it does allow for more efficient use of the existing dopamine through modification of areas in the brain where those dopamine signals are processed. So specifically in movement areas of the brain called the basal ganglia. In addition to neuroplasticity, again, exercise is neuroprotective, again, in animal models, but in animal models of something called Lewy body disease, so similar to Parkinson's disease, mice that exercised for 3 months had significantly less alpha-synuclein, so that pathologic protein aggregation, compared to sedentary mice. Okay. And again, this was a very interesting study that came out last month from Yale. So this actually points to some reversibility with high intensity exercise. So basically in this study, it was a very small study, proof of concept involving 10 patients, but those 10 patients who participated in high intensity aerobic exercise, so aerobic exercise where they were reaching 80 to 85% of their maximum heart rate for age, they actually showed that they had preserved dopamine producing neurons compared to controls. So these people did a 6-month program called the Beat Parkinson's Today program that again focuses on high intensity exercise. And at the end of 6 months, they used specialized brain imaging, so MRIs that look at looks at something specific called neuromelanin, which is present in dopamine producing neurons. And it showed that neurons had actually grown healthier and produced stronger dopamine signals. So again, this is a very recent, very small proof of concept study, but it is very promising. And again, just reaffirms the important role of exercise. Okay, so the Parkinson's Foundation has actually partnered with the American College of Sports Exercises, and they make specific recommendations for what is the ideal exercise regimen for someone with Parkinson's disease. So they focus on aerobic activity, strength training, balance, agility, and multitasking and stretching. They have specific workbooks and exercise protocols, and you can actually go to the Parkinson's Foundation and download, and they give you an exercise regimen to follow. Okay. We're fortunate that there are a lot of exercise programming options available. So these are just some online options. So the Parkinson's Wellness Project that you heard earlier, that Susan mentioned earlier, has fantastic programs with workouts. Yeah. The APDA offers daily exercise classes. The Parkinson's Foundation offers Fitness Fridays, online virtual classes. And these are just a number of other options. In addition to the online virtual options, you can always work with your physical therapist, your trainer, and there are a lot of options for exercise. So there's something for everyone. And that is it. Thank you so much. Thank you. Yes.
No, we'll have it on our, this is all being recorded and it will be on our website. Yeah, the whole event. Yeah, well, yeah. So everybody can get this. It'll probably be up on our website next week. Pam. Yeah. The lift.
So the LIFT program is available to our patients at Cornell, and televisit option is available.
Yes, all of those issues are discussed in the LIFT program. So nutrition, exercise, needing home health aid hours, psychiatric support, trying to really find resources that it's hard for us to give a patient in like the 30-minute visit. And that requires a little bit more research. In terms of the telemedicine, we just have to be a little bit careful because of the COVID restrictions are basically gone. So like if we're not licensed in another state, it gets a little bit more challenging. So I don't believe we have our New Jersey licenses anymore. I know, I'm so sorry. Not that we don't love New Jersey, but it's just hard to maintain multiple state licenses, but we'll work around your schedule to, and also the educational information is available virtually. And if you need anything from us, we're always one Cornell Connect message away. So you don't have to worry about that. So if you can't make it for multiple, try your best to do it for one, and then we'll set you up after that.
We're going to take questions at the end. We do have one more speaker, but before I bring him on, I just want to say one thing about exercise also, is that you could hear all about this, but you have to do it. Okay, so it has to become a discipline, and it has to be something that you like to do, or else you're not going to do it. So this is for your health and it's for your benefit. And we have to integrate that into our life.
Just wanted to definitely echo what Susan said. That's really important. And what I often tell my patients is that if the therapist is not making things harder for you, the next time you go, you're probably not putting in enough work.
And you have to have fun, right? Okay, so now I the doctors are going to stay here because, oh, Simone, can you ask that question after, or you want to do it now? Can you talk louder? Do you have to be a patient at Cornell to receive that support?
Right now, yes, because we're still working on the logistics of everything. But, again, you can keep your regular neurologist. We're always, we're not here to steal patients. But if you want to, so yeah, so what I would probably recommend is, what people do is that they'll come in for a one-time consultation with us. So they're basically part of the practice. And then we usually work with the local neurologist or the local movement person in your area, and you can continue to see that person. But that'll get you into the supportive care clinic. Sure. It's probably just the main office number. So it's 212-746-2584.
Okay, so as I said, Dr. Sarva and Dr. We are here. We're just going to hear from Dara Coleman. Let's get him, Dara, up on the screen. Let's welcome him. Yeah, we're zooming him. Dara Coleman is a Buteyko breath practitioner, and you're probably all looking at me like I'm crazy, like, well, what is Buteyko, right? Luckily, what's great about having this organization is that all of you people are part of it, and you tell me things that you find out. And then I call the people up and I talk to them, and then I see if they're the right people for us. So I love that when you find anything out that's working for you, that you share it with us. And that's how we get to bring all our speakers here. And that's how we get to know who the good doctors are also, because you always are telling us your responses. But I want to introduce Dara Coleman. He happens to be at the Esalen Institute in California right now. So he's zooming in, and they just had a power outage. So I'm hoping he's going to be steady. So let me tell you a little bit about him and why we asked him to come. This is going to be an experiential part of our program, and it was inspired by Dr. Wee's talk on stress management, because what Dara Coleman does is to help that aspect of our lives. So originally, Dara Coleman is from Ireland. There he is in the little box up there. I wave, Dara. Yeah, okay. He's a graduate of the William Esper Studio in New York City. That's an acting school, right?
Yeah.
Yes. And he is an experienced actor with a demonstrated history of working in the performing arts industry, including the theater, television, and film. After a car crash in 2012, through recovery, he started researching various breathing methods. And he began to understand the extraordinary power of the breath. As he said, the nose knows. He then studied with the founder of, he found the Buteyko method, and he'll tell you a little bit about that, and was taught by Patrick McEwen in Galway, Ireland. I'd like, Dara, you to tell everybody all about what you're doing, and welcome to New York. And I know you're going to explain some of the breathing to us and then share some exercises with us. So thank you very much.
Thank you, Susan. Hi, everybody from California. I will keep this kind of short because you've had just a couple of brilliant speakers, and including what Susan has said. If you could listen to just one thing, I would like to invite you to explore. Don't please think that I am right or wrong. I would love for everybody to just think about how they breathe and what they breathe through. And my purpose working with people is simply to heighten the power of nasal breathing. That's it. You can go sleep, go for lunch, leave the room, exit, explore the power of nasal breathing. About 30 to 50%, apparently, as I understand it, of the world's population breathes through the mouth. And if you look at a diagram of the nose and the mouth and the nasal cavity, the nose is a perfect instrument for us to be breathing. And it is a way forward to balance the parasympathetic and sympathetic nervous system. We breathe primarily, and the doctors feel free, anybody to jump in and correct me if I am drifting. But we breathe primarily for the gas carbon dioxide. And if we breathe through the mouth, we dump out that gas, and we do not maximize our opportunity for oxygen to be released from hemoglobin red blood cells into the tissue and brain. So what I do with people basically is I go through very simple exercises. As a coach, I'm not a doctor, a guru, anything of the sort. In day-to-day, incorporating these breathing exercises into your life in order to focus the mind on thinking about how you breathe. So if you're in New York, you're walking down Fifth Avenue, you're not thinking, about CNN or headlines in the New York Times, you're thinking about how you breathe. And ultimately, less is more. How you control, I'm careful with the words control, how you work with, how you are hyper alert and conscious to your nasal breathing with your tongue, believe it or not, is at the top of the mouth, should always be at the top of the mouth. And you just might find through gradual practice that your lives, it really will enhance your lives in ways that you never imagined. To step back a little bit, to be honest, my life, I couldn't avoid not getting into breathing. As Susan said, I come from a performing arts background in acting. And early on as a young actor, I struggled with nerves a lot. Going out on stage beforehand, it was, not a pretty sight for me. It was very nerve-wracking, and I would freeze. And I remember my acting teacher, William Esper, saying, you need to, explore movement. And I didn't really know what that was, nor breathwork or relaxation. Those things were just not in my awareness at that time. So through the years, this is personal to me, as my father had Parkinson's, and he died in 2009, and that's when I started getting interested in meditation. I was in a car crash in 2012, and I came to sort of a realization that no matter what life brings to you, that there is actually a way to meet, you may not conquer it, but you can meet it and buffer the traumas and pains of life in quite an extraordinary way. And that, to me, from what I want to share with you today, is how you are hyper alert and consciously aware of how you breathe. And there's many other things that can be done to enhance. I kind of like to work in a holistic way with people. So how you go to bed, everything that you do every single day can embroider just a very different rhythm and pattern to your life. And again, just to go back on what the doctors were saying, things like movement, exercise, your diet, how you sleep, these are essential things. And coming from an Irish background, often, we kind of smile and laugh at these little simple things that we really often take for granted, So from an exercise point of view, if you bear with me, just another thing about the tongue. So 30 to 50% of the world's population tends to be mouth breathing. So when people do that, you might notice, so the mouth drops down, the mandible eventually starts to retract and goes back, and people get that overbite. And the mandible is quite a heavy part of the body. And if your mouth drops down, the tongue comes off the roof of the mouth. This is quite a heavy part, as I said, and the head starts to come down, puts pressure on the neck. Shoulders then start to pull down, encroaches on the lungs, the upper chest, and all of that weight then impacts the diaphragm, which is really essentially where we all need to be way more aware of where we're breathing from. So one simple exercise is, you know, if you become aware of your tongue at the top of the mouth and you start to nasal breathe, you might just find, you put a little half smile on your face, you might find that the head sort of sits up a little bit. When the head sits up, the rest of the body, it's kind of like you look at nature. You know, we got yoga from looking at how the animals stretch. You look at how the flowers and the trees blossom to the light. There's an opening, it's a rising. You know, so if we can do that with ourselves, and as opposed to letting ourselves collapse and fall in, we'll strengthen the core, and we can really maximize the airflow capability and get oxygen into the tissue and brain. And that is one of the essential things, no matter if we're talking about Parkinson's or everyday health. So in order to do that, if you bear with me, so put the tongue at the top of the mouth right now. Put a hand down on your navel, one hand on the upper chest. And you can either open your eyes or close your eyes. And I just want you to breathe slowly. There is no force in these breathing exercises. Just very, very gently come into awareness of your breathing and start to slow it down, in and out, inhale and exhale out through your nose. And if you have thoughts, including what is this Irishman talking about, let those thoughts come and just focus back in on your breath. And be aware.
We want to make sure, Darryl, we want to make sure that everybody in the room is doing this with you.
Correct. Yeah, it is an invitation to try this right now. You put one hand on the upper chest, one hand on the belly, your tongue at the top of the mouth, and just start to feel the expansion of the diaphragm. And inhale in and out. And you can close your eyes, which might make it easier for you to concentrate on that movement. If you start to breathe in for maybe 5 or 6 seconds, you take a little pause and then exhale for 5 to 6 seconds. And if it becomes too stressful, there's no force, as I said. This is a gentle slowing down, very quiet, quietening the system. And when carbon dioxide rises, it's a bronchodilator. So what you're doing here is you might feel a little bit of pressure in the upper chest. You start to open the airways. So continue just quietening down the breath. And then ever so gently, just bring your hands to your sides, just below your ribs. And again, just gently press in a little bit. And feel the expansion of your diaphragm. And again, start to slow that down, really quiet and soften the breath. No big breathing in Butico. No big, none of that. And now bring the hands up to the back of the head. And just lengthen the core. Just really, really stretch up the back of the neck. And again, slow down the breath. Breathe in for 4, 5, 6 seconds. And make those 4, 5, 6 seconds your 4, 5, 6 seconds. This is about tapping into the rhythm and pattern of you, not anybody else. This is you breathing. So make them your seconds. And take a little bit of a pause in between the inhale and the exhale. And on your next breath, just breathe in for 4, 5, 6 seconds and hold for 5, 4, 3, 2, 1. Release. As you start to slow down your breath, you might notice that more saliva comes into the mouth. So one interesting study that I heard that was done with sharpshooters. I'm not a military person, but for those, you know, when they are shooting, that they would start to slow down their breath. And the moment where they would release the trigger is in the exhale, at the end of the exhale. So when you breathe in, the heart rate speeds up. When you exhale, the heart rate slows down. When you slow down the heart rate, you trigger the vagus nerve, and that secretes a neurotransmitter called acetylcholine, which brings the heart rate down. What I love about the sharpshooter story is the accuracy of it. And if anything, I think that we all could benefit from a more accurate life. Accurate in the food we choose to eat, accurate in the sleep that we take, the exercise we get. And this is something that we do every single day. I reiterate what the other doctors said. They are spot on. Exercise, your breath, your diet, your social connection, what you choose to watch, how you choose to speak. All of these tiny, subtle things can dramatically have a huge impact on your life. That is something that I really would encourage you to explore. Don't agree with me, don't disagree with me. But the beauty of science today is we have this technology. Back in the day, science was always 10 years behind human beings. The behavior of humans was, well ahead. Now we can look in and check this information. We can check it on multiple different sites. We have doctors there. You can reach out to them, via email. And so this information is at our fingertips. It's up to us to really, take charge and get into that. There's a couple quotes I just want to actually read you, to which I stumbled upon this morning. And I felt appropriate for today. The only way to achieve greatness in life is to have patience, consistency, and discipline. I'll read that once more. The only way to achieve greatness in life is to have patience, consistency, and discipline. And that is by a lad called David Goggins. And the other one is Heraclitus. Day by day, what you choose, what you think, and what you do is who you become. So again, to circle back, I really encourage you to explore the power and the awareness of nasal breathing. If you balance your autonomic nervous system, your parasympathetic, your sympathetic nervous system, if you think about that you're getting the correct volume of air in through the nose in order for the gas exchange to happen in your system, that you're getting the correct amount of oxygen to your brain in order for it to function in the best possible way, it's a no-brainer of how that can change your life, because it's you yourself will tap into your own intelligence. It's not about the books, not about the documentaries and the films. It's something that's in us. And what you can do is you can become so still, so sensitive to the actual phenomenon of being alive, that these ideas, there's a unity in this, that there's a coming together where you can really, really have a huge, huge impact on your health, your mental health and well-being, and your physical health. And on that note, I shall give you a couple more exercises to do. If you just very, very gently take the right hand and block at the side of the nose, not the front of the nose, the side of the nose, and just breathe in ever so gently through the left nostril, if you can. If you have a very broken, my nose is quite broken from playing rugby as a kid and various other things. But if you can, again, no force in these things. I want you to picture it as if we were in the forest and it was hunter-gatherer days. Not much has changed. We've just built a few buildings. You want to be ever so quiet. You don't really want to be out in the forest going, breathing loudly. And even from doing that, you can feel how dry the throat gets. We have hairs in the nostril. We have a filtration system. It heats, it cools, it brings in the correct volume for a reason. So just bear in mind that image, to be very nice and quiet and gentle and soft. So gently place the thumb at the side of your right nostril. Breathe in and out through the left for a few moments. Very gently. Keep the tongue at the top of your mouth and your mouth gently closed. And now switch to the other nostril. And now begin to alternate your nostrils. So breathe in through the left for 4, 5, 6 seconds. Breathe out through the right, 4, 5, 6 seconds. Continue doing this, and I'll just, normal humans generally, or the normal breathing rate for people is anywhere from 12 breaths to 20 breaths per minute. When you slow it down to 5 or 6, you optimize homeostasis. So you go into balancing the system, the pH. So just continue doing this. If your eyes are open, that's fine if you feel more secure and comfortable doing this, or you can close your eyes. And just keep alternating the nostril for a few moments. And then just bring the hands down. And normally, when I practice with people, we would do this for a couple of minutes. That's the discipline. Some of it is, it seems kind of monotonous and slow. It's not a hack. It's not an immediate, but you can actually, through concentrated breathing, change your whole physiology within 30 seconds to 3 minutes, no problem. And we're not talking about hyperventilation. That's a whole different ballgame. One other exercise to do, which you will heighten carbon dioxide, and it's something I want to bring up just with exercise. Simply when you go walking, the physical movement will heighten carbon dioxide. And if you meet the exercise with your breath, don't, for those of you maybe who are runners or you go to the gym and you do very intense workouts, I would encourage you to explore balancing the exercise with the breath. Bring the exercise to the breath, not the breath to the exercise. If I can give the image again, if we were in the forest, the only time you might open your mouth to breathe is, there's a bear running out of the woods. You might want to move and sprint pretty quickly, or, and it's that. But it's only for a split second. Otherwise, if you breathe through the mouth, as I understand it, you're dumping carbon dioxide. If you dump carbon dioxide, oxygen will not leave the red blood cells and get into your tissue and brain. That's something that you can have a think about. So truly, again, that expression, less is more. Less is more. And I'm talking about when you're very focused. This is not about, okay, yeah, I'm breathing through my nose, and on I go and do my shopping. This is how you go and do your activities as you do them. You can breathe in, breathe out through the nose. You're talking, your awareness. I invite everybody to a sort of a freshness, a new way of how we can kind of behave, or maybe it is a recircling back to originally how we were behaving. Because we actually live in very sort of dopamine drowned kind of, societies. It's not healthy to have, so much dopamine coming at you all the time. You can get dopamine depletion, as far as I understand. So one other little exercise that I would do very gently again, if you can, is take a normal breath in through your nose. And when I say normal, that's just as we're breathing here. Just, if you were to picture a conductor conducting a very gentle piece of music up and down. So breathing in, exhale through the nose, very gently pinch the nose. Count 1, 2, 3, 4, 5. Release the nose. And when you release the nose, breathe back in. There's a gas called nitric oxide which is a potent bronchodilator and vasodilator. So enabling the blood to flow more easily and opening again up your airways. So again, normal breath in through the nose, normal breath out through the nose, pinch and hold. 1, 2, 3, 4, 5. Release, breathe normal. You might feel a little rise in the chest. See it as your airways start to kind of open. And again, normal breath in through the nose, normal breath out through the nose, pinch and hold. 1, 2, 3, 4, 5. Breathe in through the nose. If this is difficult for some of you, you know, in any way, shape, or form of holding the breath, do not force. Again, I reiterate, this is a really important. I want you to aim for the subtlety. Some people can only hold their breath for 3 seconds. They're incredibly sensitive to carbon dioxide rising. Take a normal breath in again, normal breath out. Pinch and hold. 1, 2, 3, 4, 5. Release. Breathe normal. Nice and quiet. Really just turning down the volume of the system. Again, normal breath in, normal breath out. Make sure your tongue is at the top of the mouth. 1, 2, 3, 4, 5. And relax. So these are things that these little exercises you would extend in time. And you practice, you know, it depends on the individual. Some people need it more than others. Some people, you know, the change in awareness to your breathing respiratory system can be, you know, a process of 3 to 6 months, sometimes longer, sometimes shorter. But there is other tools, again, to be aware of that, you know, when you start getting into the breath, that you will naturally start to think about, you know, in terms of diet and how you sleep. There's a process called thermoregulation as well, which certainly I practice and people who I work with seem to enjoy, which is getting into a hot shower, a hot bath 2 hours before bed. You know, it's really, you know, tomorrow depends on how you go to bed tonight. And I reiterate that, please cherish your sleep. It's really important, and how you go there. Stay off the blue lights, the screens, the televisions, the news, everything within the last couple hours of going to bed. I know a lot of this can be conflicting with modern day society, but, you know, choose life, choose life. And on that note, check notes.
Dara,
Yeah.
can you hear me?
Yeah, I can.
Okay, great. So that was amazing, right?
You're
I
very
think
welcome.
we're all so relaxed, but we want to learn more from you. So we'll have to either bring you to New York, or you'll have to come back to New York, because Dara is from New York, basically. He's based here. We're trying to get him out of the West Coast and back into the East Coast, right, Dara? We're gonna make the East Coast your home. Anyhow,
with that invitation, it would be hard for me to refuse. Thank you, Susan.
but anyway, we do want Dara to come and do some breathing work with us, because we know that mouth breathing is not healthy for us, and I'm sure the doctors are very aware of that. And so thank you so much, Dara. We're going to open this up to Q&A right now. So anybody has any questions for either Dr. Sarva, Dr. Weill, or Dara, please, now is your chance. Ask away. Karen, do you have a question? Oh, okay. Should I turn this off? Oh, here. Oh, here.
Right now?
It's there to you.
Okay, I have a question for Dr. Weill or Dr. Sarver. With regards to the intense exercise, what would you say the guidelines are? Because I have a background in doing that just anyway. So 6 days a week. I believe that a lot of my own symptoms I masked for a very long period of years because of distance cycling. So I have a history of bike racing and road racing and things that like I got into the zen of pushing it and breathing slower and controlling my breathing, but heart rate and all these things being included. What would you say the target heart rate would be? Because I also talk to other people that are athletes that have Parkinson's, and the key to their well-being and thriving with this disease is like running marathons. There are people, which isn't the average. It is not your average person. But what would you say the guidelines are for that intensity?
So I would say, oh, okay, so I would say that the answer varies for different people. From the Parkinson's Outcomes Project, we know that for everyone minimum, if you're up to it, 2.5 hours of aerobic exercise per week, you break that down, that's 20-30 minutes a day. Now, the recent study that focuses on high intensity exercise, so that was a specific program that, again, make sure to check with your primary care doctor, make sure you're overall healthy and cleared for high intensity exercise. But that was where they reached 80 to 85% of their maximum heart rate adjusted for age. So 220 minus your age, that's the maximum heart rate, 80 to 85% of that. I believe they did like 3 sessions per week of high intensity exercise for 60 minutes. So that is higher level than the standard recommended 2.5, just aerobic exercise and no specifications for heart rate, just aerobic exercise where the heart rate goes up and you're breaking into a bit of a sweat. But again, different levels for different people and what you're able to do. So wide variety.
Yeah, I think the geriatricians also pretty much say really depends on what you're physically able to do, right? Because it's not just cardiovascular health that we have to monitor for, but also orthopedic health. So patients who have either knee or hip problems or back problems are not going to be able to reach that high intensity, but there are different types of exercise that they can do to compensate for that. So again, really stressing that 2 to 3 hour per week mark. And for someone like you, that might be too little. But it can even make that difference. Actually, there was a study not that long ago that showed if patients did like 15 minutes per week, 15 minutes, it's better than doing nothing. So the goal is to really build yourself up over time.
Any other question? Don't be shy. Do we have any questions on the chat? Okay, make one up. You're supposed to say yes. Do you want to? Okay, no. Okay. Rich, how are you doing with the Rock City boxing? Right. What's that?
I haven't been there in like 6 weeks.
Okay, don't feel guilty. It's okay. All right, you answered right. Any other questions? Okay, yes.
Okay, we're
Mrs.
talking about anti-anxiety and using pharmaceuticals to control some of this. We have a health professional in the family who loathes chemicals of that nature. She's not doing well off it. So we like to know what other people's opinion are, professional opinion.
Okay, I'm turning this off.
I really think it really takes a holistic approach. Obviously, patient preference matters, and we definitely want to have patient's input, person's input. You're the ones dealing with the disease, and if we can address everything holistically, so absolutely everything we discuss: exercise, meditation, stress, but also and stress management, but also realize that with Parkinson's, you already are dealing again with a baseline altered neurochemistry. You are in a dopamine deficient state, and that is why we see a higher incidence of non-motor symptoms like anxiety and depression. So if it takes as one part of that holistic approach is medication, then it is medication.
Does that answer your question? Dr. Sarver, do you want to add to that?
Yeah, I just want to say that, there are times where we're going to have to use medications and not to be fearful, right? I think one thing we fail to do is to reassess our medications with our doctors, whether it's our primary care physicians or psychiatrists or even our movement disorder neurologists. I think it's important to go through the med list and ask, do I need these meds and what am I taking these meds for? In our busy practices, and we're all guilty of it, we just renew meds, right? Oh, do you need a prescription renewal? Yes. And just click, 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 click. But sometimes those meds are not useful anymore, or they're, as Mr. Coleman said, less is more. So it's important to have that discussion with each of your prescribing physicians. I'm sorry? Yeah, so I mean, we have a small bag of tricks that we use for mood disorders, but it is really a multidisciplinary team approach, right? So if you're having urological issues, I often recommend both my male and female patients to a urologist for complete evaluation and seeing what options there are for those patients, right? Because I'm not up to date on the urology literature. Same thing with the anxiety and depression meds. I may feel comfortable with one or two medications, but that may not be the right medication for you or for someone else. So we want to make sure that we're really utilizing all of our sources. And also with gastroenterology, I don't prescribe medications like Linzess or something else, but general GI counseling. But we also want to make sure that your colonoscopies are up to date and that we're not missing anything else, that there's not like bacterial infection. So it's important to have the other subspecialist involved so that we're not missing something.
Thank you.
Ups and down system. I cannot even rely on myself anymore. Everything is out of control in my house. And I feel a little bit assurance that if I don't need this medication, it's not hard to pull back.
You'll work that out with your doctor. Oops, we have a question over here. Wait, let me just make sure that you could hear me. Okay, this is a question.
I was going to make a comment actually more,
will you
but
introduce yourself?
yes, yeah, I'm Sarah Mulaputla. I'm a neurologist, but I also teach stress management, meditation, and breathing exercises.
Bam.
The comment I was going to make was in response to Derek Holman's breathing exercises, but it's relevant to this last question as well. But first, I just want to say it was very nice. Thank you for the breathing exercise to experience a little bit. And in particular, I don't know if anybody else noticed the saliva when he mentioned that. And for me, I had never actually experienced that. So I learned something new. But what went through my mind was the research that we have recently that I thought might be relevant to share, that there was an article published in the journal Nature that showed that controlled breathing did indeed increase the parasympathetic, the relaxation tone, but it also changed your genes. And this was after 4 weeks of practice. It really is possible to, with just a few minutes, to start to regulate your physiology. It takes a little bit of time to get your body used to it. But just relevant to the last question, it is possible with these mechanisms to change the body chemistry, the nervous system. We have these tools that now science is starting to show how you can slowly modulate it. But one other comment that was made was the idea of patience. And other tools in Eastern traditions, compassion. We have to be kind to our body. We want things, we want results so fast. But if you learn just a little bit about the attitudes of approaching some lifestyle and that was brought in the breathing exercise, just about having some patience. So that might also be another aspect to think about, that it is possible to regulate the physiology. But really, I just wanted to make the comment that the recently there is a lot of science that's supporting it, and that's what was running through my mind during the presentation.
Thank you. We're happy to meet Dr. Sarah because we'll be working with you also. Okay. Yeah. And yeah. Well, should we take one more question? Anybody? Oh,
I
okay,
jump in
Laura.
with what Dr. Sarah said.
I guess this is a medical question about medications and stuff. So I find that you go to the doctor, you talk to the neurologist, she says maybe increase this or not. Then you have another problem, you go to your doctor, your regular doctor. Now there's some like swelling in your feet. Is this from Parkinson's? Is it not from Parkinson's? We'll give you this pill. Then you go to the urologist, and then it's like we give this. I feel like the box is getting fuller and fuller. And I think less is better. I want, so I don't have clear-cut answers. What is from the Parkinson's and what is not from the Parkinson's? If you read, there's a lot of things that are from the Parkinson's. So when you're getting medication for your swollen feet, because maybe it's from the blood pressure or you're retaining water, is that now the heart or is it the Parkinson? So it's very hard, I think, to distinguish all the medications on which one is for what.
Yeah, I agree. I think the one thing I will say, and I say this to all my patients, is we need to make sure that we're not blaming everything on the Parkinson's, right? We want to make sure that we're taking care of all of the potentially life-threatening things first and foremost. So if you're retaining water all of a sudden, or you're having shortness of breath, you need to make sure that your heart and lungs are fine, that your kidneys are fine, and that your liver is fine first. And if those all check the boxes and everything is okay, then it might be a good idea to start pulling off some of the meds, or seeing someone about anxiety and mood disorders, or doing deep breathing, or working on exercise and things like that. But for me, and I'm going to pass the baton to Dr. Weill, but I always want to make sure that we're not missing something and saying everything is from the Parkinson's. Because I remember when we were in fellowship, one of our mentors had a patient. She's an amazing physician, Vicky Schenker, who's at Mount Sinai, Beth Israel. And we all know that constipation is a huge issue with Parkinson's. But something wasn't adding up. So she was able to get an MRI of the patient's spine, and the patient had leukemia. So that's just, and she mentioned that to me, and she was like, listen, you're going out into the real world, make sure, don't blame it all on the Parkinson's. Make sure you're doing your diligence, because there are multiple body systems that we have to keep an eye on.
Do you still do you just not treat it, or do you still have to treat the symptoms?
Right. So it depends on what it is, right? So leg swelling is very common with some of our meds, like amantadine. So if we've made sure that someone who's say 65 and high blood pressure has, their heart is in good shape, the cardiologist cleared them, and then we look through the meds and say, oh, you're on amantadine, we're going to pull you off, recommend some compression stockings, some exercises, elevating the legs. And if the leg swelling gets better, great. But we always want to make sure that there's not anything wrong with the heart.
Oh, wait, let me come over here. This is my microphone.
Hi, my wonderful chiropractor, she's treating me holistically, has lots of great ideas, treats my body beautifully. She believes very heavily in neurotrophins and supplements, Neuroplex, CoQ enzyme Q10, 12 I'm taking. How does the field feel about, if anything, about these? I know nobody wants.
I know you just took the. You just took the words right out of my mouth. So I think it's a worthwhile avenue of research. Unfortunately, we just don't have the clinical evidence right now to say that any of those specific things has a concrete benefit in motor symptoms of Parkinson's, non-motor symptoms of Parkinson's. That being said, just because the clinical evidence isn't there doesn't mean that it doesn't have some benefit. So I would just take a very cautious approach. And as I mean, you just took the words right out of my mouth. That's exactly what I tell my patients. This X, Y, and Z doesn't have clear clinical benefit, but if you're taking it and it feels like it's helping you and it's not causing any harm, absolutely continue.
I think all three of us physicians, Dr. Mulakutla included, will agree that, there's a lot of stuff that's being tried and sort of recommended, that will do, X, Y, and Z, but may not. But remember, a lot of these, vitamins and supplements, a lot of that you can get through healthy diet and nutrition, right? So a lot high fiber, a lot of fruits and vegetables. Right. Yeah. I mean, and even some of the spices and stuff, you don't need to take capsules and capsules of stuff. Just use what, and if you eat better, you're already doing a lot of that on your own. The other thing I also will say is cost is always a concern, right? So if you're paying a lot for a lot of supplements that are really unnecessary, you may want to think about that again. Some vitamins are useful. So if you're deficient in vitamin D or B12, for sure have those repleted. CoQ10 is often given for patients who are on statin drugs for cholesterol. So that's, by cardiologists. So those are often combination things, a routine multivitamin, iron, all of those are part of standard of care. And those are accepted for overall good health. But again, a lot of the things you should be able to get through a healthy diet.